When I go to a hospital in an English-speaking country, I usually feel a little nervous. Hospitals are busy, and people speak fast. But over time, I learned that the English used in hospitals is actually quite simple and practical. Today, I want to share a natural, spoken-style guide about hospital English, as if I am talking about my own experience. This is especially helpful for beginners who want to feel more confident when seeing a doctor. When I arrive at the hospital, the first thing I do is go to the reception desk. I usually say something simple like, "Hi, I'd like to see a doctor," or "Hello, I have an appointment." If I already booked online or by phone, I can say, "I have an appointment at 10 a.m. The receptionist may ask for my name, my ID, or my insurance card. If I don't understand something, I just say, "Sorry, could you say that again?" That is completely okay. Sometimes I don't have an appointment. In that case, I might say, "I don't have an appointment, but I feel really sick," or "Is it possible to see a doctor today?" They may ask me to wait, and I usually hear, "Please take a seat," or "Have a seat and wait for your name to be called." While waiting, I try to relax and listen carefully when they call my name. When a nurse calls me, I follow them to a small room. The nurse often asks some basic questions first. They may ask, "What seems to be the problem?" or "What brings you in today?" I try to explain my problem simply. For example, I might say, "I have a bad headache," or "I've had a sore throat for 3 days." I don't try to use difficult words. Simple sentences are enough. The nurse may ask about my symptoms. They might say, "Do you have a fever?" or "Are you feeling dizzy?" If the answer is yes, I say, "Yes, a little," or "Yes, since yesterday." If the answer is no, I just say, "No, I don't." They may also ask, "How long have you felt this way?" I can answer with something like, "For 2 days," or "About a week." Sometimes the nurse checks my temperature, blood pressure, or weight. They may say, "Please sit here," or "Roll up your sleeve." These are very common instructions. If I don't understand, I ask, "What should I do?" Nurses are usually patient and kind. After that, I wait to see the doctor. When the doctor comes in, they often greet me with, "Hello, how are you today?" I usually reply, "Not so well," or "I'm not feeling very good." Then the doctor asks more detailed questions. They might say, "Can you describe the pain?" I can answer with simple words like, "It hurts a lot," "It's a dull pain," or "It comes and goes." The doctor may ask where it hurts. I can point and say, "It hurts here," or "My stomach hurts," or "I have pain in my back." They may also ask, "Does anything make it better or worse?" I might say, "It gets worse at night," or "It feels better when I rest." Sometimes the doctor asks about my medical history. They might say, "Do you have any allergies?" If I do, I say, "Yes, I'm allergic to penicillin," or "I'm allergic to peanuts." If not, I say, "No, I don't have any allergies." They may also ask, "Are you taking any medicine right now?" I can answer, "Yes, I'm taking painkillers," or "No, I'm not taking any medicine." During the exam, the doctor may give simple instructions. They might say, "Please lie down, open your mouth," or "Take a deep breath." I just listen and follow. If something hurts, I can say, "That hurts," or "It's painful here." Doctors need this information, so it's okay to speak up. After the exam, the doctor explains what they think is wrong. They may say, "It looks like a cold," or "You have an infection." Sometimes they speak fast, so I listen for key words. If I don't understand, I say, "Could you explain that in simple words?" Doctors are used to this, especially with non-native speakers. The doctor may give advice. They might say, "You should get more rest, or drink plenty of water." They may also say, "I'm going to prescribe some medicine." If I don't know how to take the medicine, I ask, "How often should I take it, or should I take it before or after meals?" These are very important questions. Sometimes the doctor orders tests. They might say, "You need a blood test," or "We need an X-ray." I usually reply, "Okay," or "I understand." If I feel worried, I might say, "Is it serious?" Doctors often reassure me with words like, "No, it's nothing serious," or "We just want to be sure." Before I leave, I may ask a few final questions. I might say, "When should I come back?" or "What should I do if I feel worse?" It's good to be clear before leaving the room. The doctor may say, "Come back in 1 week," or "Go to the emergency room if the pain gets worse." After seeing the doctor, I usually go to the pharmacy. At the pharmacy counter, I say, "I'm here to pick up my medicine," or "I have a prescription." The pharmacist may explain how to use the medicine. I listen carefully and ask questions if needed. For example, "Can I take this with food?" or "Are there any side effects?" Going to a hospital in English may feel scary at first, but it gets easier with practice. The most important thing is to speak slowly, use simple words, and not worry about being perfect. Doctors and nurses care more about understanding your problem than about your grammar. Even short, clear sentences are enough. Over time, I realized that hospital English is about communication, not perfection. When I stay calm and speak honestly, people understand me. With these simple spoken phrases and this mindset, visiting a hospital in English becomes much less stressful and much more manageable.